Hey, Paul, I'm trying to get Commissioner Kafori signed in. I think there was an error and I'm trying to,
Able to sign in.
yeah, I'm trying to get her to signed in, but
I had to try it twice, if that's any consolation. I mean, so maybe just have her shut the whole thing, not on her computer, but like get out of the WebEx and
Totally understandable. All right. Please hold.
so we do have a quorum.
Okay. It'll be just 1 moment. All right, let's get started. Good afternoon. Welcome to the Board of Multnomah County Commissioners, our informational board briefing. I'm Deborah Kafori, your Multnomah County Chair. In accordance with the declaration of emergency announced on March 11th and extended by the Board of County Commissioners on April 9th, today's meeting is being held virtually. I want to thank everyone for bearing with us through any technical difficulties that may arise throughout our virtual meeting. Please remember to mute your mic when you are not speaking, and when you're presenting, make sure that your mic is unmuted and your camera is on. I ask presenters to remember that the public may be listening via phone, so please state your name before responding. Today's informational briefing on COVID-19 will be on the reopening dashboard update. We're going to start with Chris Voss. Director. I said that very strongly. Chris Voss. There you go.
Great. Well, good day, everybody. I will start up. My name is Chris Voss. I'm the Director of Emergency Management for Multnomah County. And why don't we go to the next slide? First off, just a brief overview of what we're going to talk about today. The reopening framework, disease spread and viral transmission. We're going to provide a few dashboard updates and then move into public health guidance for phase 1, as well as the communication with businesses and other stakeholders. So why don't we go to the next slide? We're happy to sort of report that on Friday we submitted our plan to the state. Hopefully many of you have sort of seen it. It is up on sort of the state website as well. The state obviously received it. It included a cover letter from the chair, from the public health director and the county health officer. And then we walk through many of our values as well as the reopening framework. Why don't we go to the next slide? And just if you hadn't had a chance to go through the whole thing, there's really just 1 or 2 slides here about what was in the plan. So this is mostly our table of contents that we sort of presented to them. And you can see sort of a sample of, some of the tables that we also included as well. What was important for us, and probably the whole upfront piece for this, was really the county values and how we were sort of leading and supporting our efforts in the county. So we spent quite a bit of time on that, and we know we've had several briefings with the commissioners. So next slide. And then another component we had several appendices as well, including the BIPOC reopening framework and our COVID-19 testing strategies. All important that we thought we wanted the state to sort of have as well as they consider sort of next steps and decide to approve or not approve our plan. Next slide. At this point, I'm going to hand it off to Jen, and she can talk a little about sort of the spread of COVID-19.
Hi, good afternoon. Can I just get a quick sound check with a thumbs up from people I can see? Great, thank you. So good afternoon, Madam Chair, Commissioners. This is Dr. Jennifer Vines, your Multnomah County Health Officer. I'm going to speak to the question on everybody's mind, which is what's going on with spread of COVID-19 in our county ahead of the big step of reopening. So here you see a graph. This is provided by Oregon Health Authority. This is percentage of emergency department visits for illnesses that look like COVID-19. If we could get back to that slide, I will acknowledge, oh, yep, back one. There we go, thank you. I will acknowledge the uptick there that you see on the far right. This is a preview of more data to come. I will point out that this is overall, these are small numbers. The actual number is 14. So in a county of 800,000 people, that's relatively few people. But no question, there is an uptick there on this graph. And Marina, I'll ask you to move forward to the next one. Here we have hospitalizations. Again, another uptick there that you see on the far right. You see this broken down by Black, Indigenous, persons of color. This is a very specific build to our dashboard. I will say that hospitalizations overall have had an uptick, and you see here it broken down by race and ethnicity. So already I'm talking about increases. Again, I'm talking about low numbers as well. So if you look at the vertical axis there, it's barely reaching 10, the number 10. So again, county of a population 800,000. I will say that we expected to see an increase in cases. The whole premise of reopening, which really began on May 15th, was built on the idea that people would mix, and therefore we needed to ramp up testing to identify cases, find those cases quickly with our contact tracers, and then notify their close contacts as a way of keeping this disease to sort of a slow burn, if you will. I will say it's too soon to answer questions about the effects of the protests on our case numbers. I fully support people speaking out against the egregious death of George Floyd and against racism in all of its forms, and acknowledge that racism underlies not just COVID-19, but almost every other aspect of our lives. And if this is the way to address it, then people taking to the streets in face coverings outdoors and taking other precautions. I think from a public health standpoint, if now is the time to address racism, then by all means, as a public health issue, we need to do that. I will also just point out that Clackamas and Washington opened around this same time. So again, I think we're seeing here some early indicators of the whole notion that when people mix, disease spreads. And so I think that's probably starting to show in our numbers. And next slide, if you would, please.
Dr. Vines, can you pause once again? Commissioner Vega-Peterson has a question.
Oh, sure.
Thank you, Chair. Thanks, Dr. Vines. So I think these, the numbers around hospitalizations are interesting. You've been saying that, this is actually still very low numbers considering our population in Multnomah County. My question, though, is how this looks in terms of hospital capacity, because that's really my concern, is not just the number of cases, but also like how that correlates to where the hospitals are at in terms of their capacity and ability to respond to the needed hospitalizations.
Yeah, thank you. That's a great question. Our hospitals, I've been working closely with our health systems. They actually got very low ahead of the wave of illness we thought we would have in late March or early April. So they actually had quite quite a cushion in terms of just the available beds and intensive care unit beds. They are slowly refilling as they bring back elective procedures, but in their planning for that wave of illness, they have certified that they are able to maintain that a 20% cushion in their capacity in hospital and intensive care unit beds. And as far as I know, I don't think any of them is even anywhere near that as they begin also slowly to resume normal operations.
Okay, thank you.
So this is the last piece of data for me to share with you. In very light gray, you see total case reports to Multnomah County. These are white, people identify as white there in blue, and people identifying as Black, Indigenous, or people of color in green. You see a bit of a white predominance early on, and then you see the lines cross there with now a predominance in our communities of color. And so that's why we've centered many of our dashboard and response activities around the BIPOC communities, and will continue to do so as we think about moving into phase 1 reopening. So again, I would just say that the key takeaways are that we are seeing an uptick. Again, I think we expected it given what's been going on in our region really since mid-May. It's too soon to say if any of this is driven by recent protests. And that overall, the absolute numbers are low, again, in a county of over 800,000 people, even though, of course, I don't want to see anybody hospitalized or dying or dealing with this infection. In the big picture, it is relatively few. And I think it's time for the next slide. And I believe Rachel Banks. No, I'm sorry, Kim Taves is up.
Good afternoon. My name is Kim Taves. I'm the Communicable Disease Director for Multnomah County Health Department. I have a few slides to go over that have to do with testing and with contact tracing, which are the two programmatic areas that we have been trying to stand up robustly in order to be ready to reopen. We're feeling confident about both of those. For the first time here, we have test data, and let me just take a minute and talk about that because we haven't had that on our dashboard until now. And we have a snapshot in time right now that is data as of today, and hopefully within the next 2 weeks we'll have a dashboard up that's more interactive that people can look at. But for the next week, once a week, we'll make sure that we update it so that people do get to see the trend and the improvement, hopefully, in access to testing for communities of color specifically. So this is overall for the full set of tests. This is not just one point in time of a week, but this is cumulative. And this is looking at the percentages of the total number of tests that have been done based on race or ethnicity. And so the white on the far right is the tallest bar. The one to its left that is also sizable is unknown. And you may recall that earlier on, we had 40 to 50% of our race and ethnicity data missing in the test data. That has improved. It runs now between 25 and 30%, but there's still more work that we're trying to do with laboratories and healthcare systems to be able to report that data out. So the data you're seeing here is not about positive cases. This is the total number of tests that have been done. So that would include people who are sick or symptomatic or hospitalized. It would include people who are being tested by their surgeons before they have an elective procedure. It would include employees in the healthcare field who are routinely tested for screening, all tests in our county, positives and negatives. So what we can see here, based on the very small percentages among different communities of color, is that we know that almost all across the board, if not all, have a smaller portion of testing that racial or ethnic group has access to than what they represent in the population as a whole. And so we have seen that kind of inequity. And as we've filled in more of that race and ethnicity data, it's just been confirmed. It hasn't been that they were hiding in the missing category. That's not the case. Next slide, please, Marina. Thank you. This is complicated, so I will talk first about the colorful bars, and then I'll talk about that orange line that's sort of overlaid, because they're different pieces of information that have been put on the same slide. So these bars look again at those same racial and ethnic groups using the same color scheme, and we will have this up on our data dashboard so that people can look at it in depth, because there's a lot of information here. But this looks week by week. So we've got the numbers of weeks starting at 1 would be the first week of this calendar year. The very small bar on the far right is because we're only partially through this current week that we're in. But the other bar to its left, the tallest one, is last week that we completed. So what we're seeing overall is we are seeing an increase in number of tests done for the whole population. And we sort of have a steady need to do more work on that unknown and missing, which is the pink stripe in the middle. We would like that to be very small because that represents data that we just don't know what race or ethnicity someone has. So good news is overall testing in general across all of our healthcare systems and other providers of tests continues to increase. Testing continues to increase for that bottom bar among the white population. And if you do look up close at the numbers, you'll see that in this past complete week we did see an increase in the total number of tests among every different race or ethnic group, which is really important to us because, as you can tell from the graph before, we have quite a ways to go to make sure that there's actually equitable access. Of note, Walgreens has opened testing recently at no cost for folks who are symptomatic. We partnered with OHA and with SEI in a testing project over the past week with the real focus on the Black community. OHSU continues to maintain its low barrier testing, and other healthcare systems and clinics are continuing to work on increasing the number of tests that they provide to their own patients. And then in Multnomah County, we also, as of Monday, stood up low barrier drive-through testing at our East County Services building. So we'll be offering that twice a week, and then we'll increase that when we can. And we also do intend to make sure that there's not only coverage for some kind of low barrier testing in North Northeast, but as well as Mid-County, and then this East County site that we decided was important to stand up as the first drive-through testing that we needed to offer to an area that has been underserved with test sites in general. That testing is also for symptomatic folks. No one will be turned away based on health insurance status, immigration status. You don't need to be referred by a medical provider. There's not a telemedicine visit to do in advance of that. But right now it is for symptomatic people. And then for people who have been named as close contacts to cases, our communicable disease team is also able to directly help those people schedule at this site if we recommend that they do get tested as well. And so I think we're seeing an expansion of our focus on not only testing symptomatic folks, but on testing folks who are contacts to cases as well. And the goal there would be is if you are a contact and you did get infected, but you're just a few days into your infection, or you are one of those people who has very mild symptoms or no symptoms at all, we still would advise you to maintain that kind of quarantine status during that time period that the communicable disease health worker will talk to you about. But if you have a test, in addition, we get a little bit more information early on if you actually are positive at that time and just not symptomatic. Then we would go ahead and do that next circle out of the people that you've been in close contact to so that we can continue to try to stop that spread of transmission between people as fast as possible by giving them a heads up and asking them to stay out of society, stay out of work until they are sure that they're not infectious. So right now, because we have been able to assist with a culturally specific event and open up drive-through testing that's low barrier, as well as the rest of the testing in our county continuing to be available to folks, we've decided that we have met our benchmark for that. And I'll just talk very briefly about contact tracing, which I believe is the next slide.
Can you just pause for one moment?
Yes, I can. Absolutely.
Thank you. Commissioner Vega-Peterson?
Thanks, Chair. This is just a quick question, Kim. And first I want to say great job in getting all of this up and running. I know that has taken a lot of work. But I just want to make sure that this is crystal clear because I know that there were some issues with certain states aggregating both the testing for COVID and antibody testing data. And I just want to be clear that what we're looking at are really the numbers just for COVID testing, and it's not also antibody testing data. Or maybe.
Yeah, you're asking for the viral test as well as the antibody test. And to my knowledge, this is just the viral testing only at this point. And we don't have a whole lot of antibody testing going on in our area.
Okay, thank you.
Yep, but I will confirm with the state and I'll make sure I correct myself if that's inaccurate.
Who's got the next slide?
Okay, so contact tracing. We have continued to work on training the people that we brought into our program in the last 2 weeks, and we are continuing to do the process of sorting through and scoring the applications from people who have applied who aren't internal to our employee group yet, but wanted to apply for any of those external positions that we posted. We are doing a great job on getting people who we have brought into our program in the last few weeks up and running so that they're starting to do their own and they're not just observing and shadowing anymore. And then we do plan that we'll be able, let's see, today's the 10th, and I think on the 15th we'll be able to actually do the panels of interviews and go ahead and make job offers to hire the rest of the crew that we need that will fill out our complete capacity. So right now we feel confident that we have given ourselves the green check there for MET for the capacity right now that we have is adequate to follow up on every single case and to do the contact notification with the staff we have. And even as we continue to grow that, we know that ultimately, hopefully we will have an overabundance of contact tracers compared to what we actually need. We are also continuing to work on the language capacity, and we are missing language capacity in a few different languages that we do expect among the 1,200 applicants that we had for the positions that we'll be interviewing for on the 15th, that we will find folks there that has some of the languages that we are missing. We're also continuing to hold steady with the last measure there with our ability to respond promptly to start the case investigation, which is one of the other requirements. So that's all I have on that one, and I think the next slide is not mine unless folks have questions.
I think I'll take it from here, Kim. Thank you.
Great.
You know what?
Any questions?
Actually, pause. Yeah, can we pause for a minute? Because Kim, that's your last slide for the deck, correct?
Yeah.
Then I'm going to go through some questions. We're going to start with Commissioner Stegman.
Thank you, Chair. No questions.
Commissioner Ray Peterson, did you have another question?
No, I asked mine. Thank you.
How about Commissioner Dreyfall?
No questions. I just also want to express my appreciation for all the work that went into getting that testing data. It's really terrific to see that. So thank you.
Commissioner Myron?
No questions. Thank you.
All right. Thank you, Kim Taves. And
Welcome.
I catch you.
Okay, and I'm going to move kind of quickly through these slides because you've seen most of this information before. I just want to let you know that we obviously continue to work and work with hospitals and other organizations regarding PPE, and so there's a few slides on here. But the dashboard criteria where we are still has not changed. So why don't we go to the next slide? And first, regarding the hospital PPE, obviously all the hospitals have attested that they have PPE supply, and they continue to be well resourced. And in fact, saw some information from Kaiser today, actually, where they had some supplies and were considering offering to the other hospitals. So we continue to know this is in a good situation. And we also know that the supply chain in general continues to stabilize as well. So good signs for hospitals and other organizations. Next slide. One of the requirements we also included was PPE for key constituents. I've got a few slides on that, as well as we do communicate with our first responders as well, see where they are. And if we go to next slide, it'll probably be a graphic of one of the things we've included in our plan. And this is obviously, we asked for letters from our first responding organizations. And we are continuing this communication. So I actually talked to the sheriff's office today. They indicated they still have a 30-day supply. And so you'll see a date on here, but that was when they submitted their letter. We also talked to Gresham Police. They indicated they also had about an 8-week supply as of yesterday. So with that PPE supply chain continuing to stabilize, these organizations continue to be resourced in a manner that we consider positive. Next slide. Regarding PPE for key constituents, I think we we submitted our plan on the 5th. You saw this uptick in numbers and organizations coming to us on the 5th for PPE supplies. We actually saw an uptick as well when right before when retail was actually announced as well. I think on that day there was 100 requests coming into the county, so not surprising. I think what isn't here that's important to note is while our numbers dramatically have not increased over the last month, the request size has increased. So we still have a 30-day supply to support key constituents, but it's important to note that the requests overall coming into us have very much increased in just sort of volume. But with over a million masks that came in about a week or so ago from the state, that leaves us in pretty good shape, definitely for the next few weeks. Next slide.
Can you pause for a second?
Yep.
Commissioner Myron has a question.
Thank you, Chair. Thanks, Chris. I just, I still do hear frequently that frontline workers, employees, providers in our hospitals and nursing homes and community-based organizations do not feel that they have adequate PPE. How are we, is all of this through, all that we're measuring through looking at numbers of requests we get, or is there, what kind of proactive outreach do we have to some of these particular communities to ensure that that we're not just checking a box, but that there is actual meaningful access from the people who need it?
Sure. So obviously, while we're communicating with organizations like hospitals, we actually have about 40 or so liaisons that we work with that also represent with different groups, from first responders to organizations representing a lot of different cultural groups that we're sort of communicating. And those folks are having these conversations with these groups. So it's not just we're checking a box. I think it's important to note that we are also communicating with a lot of these groups. And when they don't have supplies, that's where you start to see sort of the ask come into us. But there's another proactive thing that I think is important that we do is it's while we want to know that the organizations that need supplies have a place to ask, and when we get these requests, predominantly most of our requests, especially from community groups, has been masks. We recognize there's some items of PPE that are still scarce, scarcer, such as gowns. We sort of know that. Well, we don't provide many in the way of gowns, but we understand that the hospitals actually have a process, and the medical groups have a process where I guess they're using reusable gowns. And so it's, like I said, not something that we've directly responded. But specifically with regard to PPE, where we're probably the most proactive is sort of understanding their ability to procure some of these items. So in the county, for instance, we test the PPE supply chain now. So I could tell you last week we reached out to 40 different organizations that supply PPE and said, hey, do you have supply, and what do you have supply of? And we were testing for the most part N95 masks, knowing that supports a lot of our healthcare organizations, and procedural masks. What we found was interesting was 50% of them said we do not have supply right now. 12 of them said we're supplying in bulk, so if you need more than 1,000 or more, we're supplying. Some of them were higher numbers, but they were considered bulk. And 8 of them said they were supplying at basically any amount. And so that for us, compared to where we were a month or two ago, tells us that, where no one really had supply, that we're seeing that improve. So I did want to say that our methods are not only with communicating with groups, we're also sort of testing the supply chain. I think right now we're seeing a lot more positive factors than where we were 2 months ago. And I would make that argument from a macro level. Sure, the individual supplier you may have still may not have stuff, but for organizations that reach out, and you try, you will find certainly masks in volume. And I know I probably get 5 emails a day from some of these groups we reach out to, sort of telling me that they have some of the stuff. I hope that answers your question.
Jennifer, Dr. Vine, helpful?
Yeah, Commissioner Myron, Jennifer Vines, Multnomah County Health Officer. I just want to appreciate how vocal you've been on this topic in wanting to protect our frontline workers. I will just add to what Chris said, a couple of really concrete things. One is that our communicable disease team will supply PPE to long-term care facilities when they have an outbreak, and that's a very low threshold for a definition of an outbreak. It's just 2 cases at the site. I also wanted to share that there's been a lot of dialogue between health systems and the state and OSHA, the Occupational Safety and Health Administration, around what constitutes sort of the new normal around personal protective equipment use. And so that's been a direct dialogue that the county's been listening in on, but we don't particularly regulate or have much of a say, given that healthcare is heavily regulated, and the state has really taken on that role around definitions for what is considered okay use of PPE.
Thank you so much, Dr. Vines. That's really helpful, and that is encouraging.
And I'd just like to add, we never just want to check a box. That is definitely not the goal of anybody who's been working on this effort. And I know that it has been my team's priority is to make sure that our community organizations, especially our BIPOC communities, have adequate ability to access PPE. So we have a form that we have on our website, and every town hall, every meeting that I'm in with community, we're always pushing that there is a way to get access, because it's a pillar of our BIPOC plan. And so checking a box is not something that's in our will.
Thank you. And I didn't mean to suggest that we were just checking a box, but I believe that there has been, the hospital attestations has been in the past in different places just checking a box. So I was not at all referring to us. So, thanks.
Great. Any other questions? Okay, I will move on. And this slide, I think some of you have seen a similar version. It's sort of specifically to highlight some of the groups that we've provided to. And this is while we've, this is about 2 months of data of PPE that we have supplied. You can see the breakdown of organizations that we're providing this PPE to. While healthcare providers are a little over half, you can see sort of those second and third groups, both congregate housing and organizations serving communities of color. Those are the top 3 groups. And we're continuing, like I said, we continue to have supplies and continue to support them. Next slide. Hotel rooms on shelters, this has not changed, but we'd like to sort of everybody just give a brief update on our numbers. And after that, then I will let Kim Taves talk a little about sort of narratives. But we go one slide, I'll highlight a little bit where we are with hotel rooms. And next slide. Our numbers compared to the 120 motel rooms that we have, still plenty of capacity here, where on 6/9, as of yesterday, we had about 27 occupants. So if we needed this additional capacity, we certainly have some capacity there. And I don't know if Kim Taves wanted to talk just briefly about the narratives. I know the state asked for 3, and we always do more. We did 4.
Sure. We completed narratives for our outbreak prevention and identification and response plans for long-term care facilities, corrections facilities, congregate shelters, and food processing center. The first 3 of those are places where people are living in close proximity to each other, sharing bathrooms, kitchens, possibly sleeping in the same room. And then food processing center is a little bit different. It's a work site that has regular shifts. However, people are in very close proximity to each other, working assembly lines, and it is definitely one of the main areas of outbreaks that we have in the state besides long-term care facilities. So it's potentially to some of the vulnerabilities of the staff are high. In terms of some of the racial disparities, as well as some concerns about accessing healthcare, immigration status, et cetera. And folks are working long hours. OSHA guidance has changed recently to try to ask those food processors and regulate them in terms of making changes to the work environment to increase infection control and to space people out and increase a whole lot of other practices that would help decrease COVID transmission. But some of those environments are a little bit difficult to change, and I think will probably remain at a certain level of risk that's higher than some other jobs. And so we look to employers to provide regular testing to folks if they need that kind of access, at least testing when people are symptomatic. And we'll work with them if they do have more outbreaks.
Okay, I think that is it for my slides. I'm about to hand it off to Rachel. I don't know if you want to pause for questions or we go right to Rachel.
I don't see any questions. If somebody does have one, all right. We'll come back to you, Chris, if you have questions.
Thank you.
Rachel.
Hi, everyone. For the record, my name is Rachel Banks. I use she, her, and hers, and I'm your public health director. It's a pleasure to be with you all again this week virtually. In terms of, and I'm going to breeze past a couple of these slides because there's been consistent capacity, and we've had these dashboard metrics checked for several weeks now. But Jen talked a bit about this as well, is that we do see that the region is able to accommodate a 20% increase in hospitalizations. And so we continue to meet that criteria. Next slide, please. In terms of healthcare capacity and digging down a little bit deeper into the ventilators and ICU beds and some of those things, this is what it looks like for us. So we can accommodate, once again, a 20% increase in hospitalizations. We're seeing a low census, and hospitals are not using their surge capacity at this point. So you see overall the number of COVID patients, has ranged between 10 and 12. As of 6/5, there's 11 COVID patients on ventilators. There's 408 ventilators that are not currently in use, 283 available beds, and then 58 adult ICU beds. So this just shows, I won't go through all of them, but you can see how we moved through that hospital capacity. And once again, that there's the ability to both accommodate a 20% increase as well as availability of beds and ventilators and ICU beds. Next slide, please. So in terms of what does guidance look like, public health guidance for phase 1, I'm going to run through some of these, and other folks can feel free to chime in. Teleworking is still...
Yes. Can you just pause for a second? Thanks. There's a question for commissioners. Commissioner Peterson.
Thank you, Chair. Yeah, sorry for the late notice. Just going back to the previous slide. So it looks like there's a pretty significant decrease in the number of available adult ICU beds between the 1st and the 5th. And I just was curious if we knew what was causing that increase. Was it, how much of that, if any, is related to COVID cases?
Yeah, I don't know. Jen, I'm wondering if you and your conversations with health systems have talked about that specifically.
I don't know that specifically. I'm wondering if Marina could just go back just so I could get recentered on what Commissioner Baker-Peterson is looking at. So between 6.3 and 6.5, Commissioner, your question. Sorry, 6.1 and 6.5.
Yeah, the number of available adult ICU beds.
I'm sure I could guess that it might be the resumption of quote unquote elective procedures, which are of course just procedures that were put off as we prepared for a potential COVID wave. I would have to check to better understand that, and I'd be happy to get back to you.
Okay, I would just be curious about that, if that kind of jump in usage of beds over a course of a couple of days is something that happens sometimes in the normal course of action. Thank you.
All right, so next slide. And thank you for that question and your attention to detail, Commissioner Peterson. So in terms of moving to phase 1 and the public health guidance, we want folks to continue teleworking. and to see businesses continuing to promote teleworking as an option. It's really one of the best tools that we have in promoting physical distance. So maintaining those teleworking policies, that's both internally and externally. There's, well, I know it's hard and people want to get together with so many folks. We want to ensure that you know, people understand that reopening, the virus is still out there. We still have no vaccine, all of those things. And to continue to limit your close contact with people outside of your household. A little bit later, I'll talk about how to reconnect with folks safely. But the underlying premise is the more people that we're connecting with and the more places that we're going, the more chance there is for the virus to spread. So physical distancing is still one of the best tools that we have, and that goes hand in hand with teleworking. The idea behind that is to maintain that physical distance from folks. We want to see that 6 feet. Whereby that's not possible, we recommend face coverings, and particularly in indoor settings where folks are not able to maintain that 6 feet of distance, and acknowledge that for some people that for safety or health reasons that they're not able to utilize face coverings, and want to make sure that those folks have the ability to maintain that 6 feet of distance. We want to see that employers and folks who own businesses are making available face coverings to their employees, to their patrons, to their customers and clients. And then really, I know it's, we've said it time and time again, but really remembering the basics of, you know, hand hygiene, limiting shared touch surfaces, limiting the amount of times you touch a frequently touched surface, and washing your hands after that, staying home when you're sick, monitoring your symptoms. Those are all tools that we must continue to use in phase one. Next slide.
Can you pause for a second, Rachel? We have some question or two, starting with Commissioner Myron.
Thank you, Rachel. And you might get to this a little later, so if so, then we can just leave that for later. But I was just wondering, it sounds like public health is not making the recommendation, or is not recommending that there be a public health directive or a requirement about face coverings indoors. And I'm just wondering if that's the case, and if so, how you made that decision.
Yeah, so that is the case, and I think there's a number of factors that go into that decision. One is, I know that there was some conversation with the board last week and really wanting to understand what communities felt, and particularly Black communities. And while, you know, I'm by no means speaking on behalf of the Black community, I can share with you in the number of town halls and conversations that we've had, I have never once personally heard anybody from the Black community saying that the answer to the public health pandemic is to add more, is to legislate them, or for governmental public health to come with another directive that's imposed on an individual level on individuals. We have very much heard that folks have concerns from the beginning about, and particularly Black and brown men, about their safety in face masks and being perceived as criminals, and the concern about enforcement. Of course, we're very mindful all the time in public health, particularly in this moment, about what enforcement looks like for certain communities and the risk of that enforcement for certain people. But what I will say that we've heard time and time again, so once again, to be clear, I've not heard from BIPOC communities that you know, put out a directive that makes us do something. What has been very clear is people have said, we want low barrier testing, we want access to PPE, we want to make sure that the contact tracers look like us, and we want to have clear race and ethnicity data. So that's a part of the decision making. I think we're also really wanting to get up a level in terms of ensuring that the systems, whether that's you know, in long-term care facilities, whether that's employers, whether that's social service providers, that they're making it available. So the approach is, you know, definitely recommending face coverings indoors when people can't maintain 6 feet of distance. but wanting to also ensure that the access is there, right? You know, people make choices based on the choices they have, that good old public health idea that we want to get above the individual and really get to some of the systems.
Thank you, and I'll have some comments about that later on. So thank you.
Thank you, Dr. Vines.
Yeah, if I may, this is again Jennifer Vines, the Multnomah County Health Officer speaking. And I know Commissioner Myron, I want to just say that I share with you the desire to see as many people using face coverings as absolutely can as a protective measure. We talked a lot, not so much about that, but about how to do that. And I think for now, we've landed on the notion that public health is ultimately a voluntary enterprise, right? So the whole notion of contact tracing and people answering the call and telling us their personal details and helping us find people they may have exposed, that all depends on relationships and essentially on people willing to work with us. And so at least for now, a direction that looked and really felt like an enforcement, it didn't feel like the right time, even though we could revisit that. But I would just underscore everything that Rachel just said and say that I share with you the desire to see people using face coverings, and our goal is to make that as easy as possible, and essentially the new social contract, in addition to the 6-foot distance and everything else that Rachel's outlined.
Thank you. Thanks, both of you.
Keep going.
Okay. Sweet. Next slide, please. So how to reconnect safely with loved ones. We definitely feel like the messaging around social distancing and washing your hands and some of that has been really clear. And as people have been within the stay-at-home orders, we know that folks want to reconnect with their loved ones. In addition to having a conversation about how to safely interact in a retail environment or some of these other environments, we know that really this is an area that we want to lift up. So it's a perfect time for visits outside where we are in the season. So anything outdoors is going to have less risk and inherently be safer in terms of connecting with loved ones in a backyard or a park or going for a walk, those sort of things. Still trying to maintain that 6 feet of distance, but once again, using outdoors as an option. Really, it's a good idea to choose a small amount of people to reconnect with, and then see how that goes, and then maybe move to the next phase. So you may hear suggestions such as pick a family or another household to interact with at a time, instead of visiting every single person that you've missed. Layer and start small. Because the truth is, the more interactions that we have with other people and the more places we go, the more chances there is for the virus to spread. Clearly, being mindful about the risk of our family members or loved ones and taking that into consideration if they have underlying health conditions or age or some other factor. And, we just want folks to keep those basics in mind. And, it's not an all or nothing. So anything to reduce risk is positive, and we know that folks may not be able to do everything perfect like the slide says, but that there's reduced harm in all of those aforementioned actions.
Will you pause for a moment? Thank you. Commissioner Dreyfus.
Thanks, Chair. Thank you, Rachel. One question, and you might be getting to this if you have more guidance slides, but one of the questions that I'm starting to get is around travel, and particularly the weird situation where we're in one phase and other counties are in another phase, and whose phase governs travel. I mean, I'm sure the recommendation is don't do it, but is there a more specific, I think there's a more specific guidance from the state about that, and how do we interpret that?
So my understanding is with the state's guidance is it's more about transit, and the recommendations for transit in terms of face coverings and what distance to maintain and what sort of capacity that the buses can have. I haven't heard recommendations that maybe my colleagues on the call have in terms of travel or a definitive, policy on like state to state travel, or, I know earlier on some folks had questions about, well, should we just, kind of quarantine the state and not let folks travel in and out. And so I haven't heard a policy on that, but I welcome, my colleagues if you have more updated information or.
Yeah, just to clarify, I was thinking more about within the state, so county to county, people heading off to Hood River or coming from Bend or that kind of thing. I thought there was something, but I might have been imagining it. Sounds like I was imagining it.
No, I mean, I think earlier we put out guidance for sure earlier on about, try to keep your activities local. And then I think, in terms of there's the jurisdiction in which people are in that their, policies and practices will stand for that jurisdiction. At the same time, we know people are traveling, across the state, and things like state parks have been opened up for quite some time.
Thank you.
Yeah, Commissioner, you're not exaggerating. The state did actually have some specific guidance related to local jurisdictions for local gatherings should not gather and travel, for events larger than 25 people. So that was phase 1, and that is in place. I don't believe it's in place for phase 2. So.
Got it. Yeah, I think that's what I was thinking of, and it just creates a weird situation where if we're in phase 1. The guidance is that folks in Multnomah County should not be traveling elsewhere in groups of 25. Somebody else is in phase 2, they can feel free to come to Multnomah County. Okay.
Right. The state provides no further guidance as to who is it the jurisdiction you live in, the work in, or where you're going.
Yeah. Thank you.
Yeah, thanks.
I had that same question as to our colleagues on the coast when they were talking about going into phase 1, and I said, so do you want people from Multnomah County to come visit or not? And they said, well, at first they didn't, but then they opened up all their hotels and Airbnbs, so it seemed like they said the welcome mat is out.
All right. So if there's no other questions, I believe that I'm turning it over to Julie.
Oh, we'll pause right there, Rachel, just one moment, and I'll see if do any of the other commissioners have a question before we move on to Julie Sullivan's survey?
Chair, this is Jessica. I just wanted to say I did a neighborhood association meeting the other night, and this was exactly the question that Commissioner Jayapal brought up, that people were wondering about, like, what does that mean? You can have 25 people, but you can't travel. So there is a lot of confusion there. Yes.
And we can, it's good to hear these sort of questions and hear what's coming up from constituents and folks, as we can clarify, work with Oregon Health Authority or other folks at the state to see if there's some clarity that can be provided.
Great, thank you. Commissioner Stegman, did you have a question?
Oh, I'm sorry, I do not at this time.
Okay, thank you. And Commissioner Myron, did you have any questions for Rika?
No, thank you.
All right, thank you. Thanks, Rachel. Julie, you're up.
Good afternoon, everyone. Hopefully everybody can hear me from the McCoy building. I'm Julie Sullivan Springgetti, Communications Director at the county, and I use she, her pronouns. The chair asked me to talk a little bit today about how we're providing information to the public as we move through this transition. And I want to start by saying I am totally the water carrier here who is trying to bring forward the work of a ton of people, the communications team, the Emergency Operations Center PIO team, which is superb, and the Emergency Operations Center liaisons who have done a huge amount of work, as well as staff from the chair's office and probably from all of your offices. So I'm just really trying to reflect the ways in which people in every transition, we're going to see a lot of concern and questions. And so I want, those are the folks and our folks who are producing content, having conversations, pushing out collateral on COVID. And there's also a really important element of the press. We rely heavily on the press. So I want to talk just very quickly about some of the things so you understand some of the ways that the county is going to be helping the community going forward, how we have been, but how we're trying to refine what we're doing and do it maybe a little bit better. You know, we're going to hopefully 1 to 2 times a week, which we have been trying to do, is give the press some access to the county health officer, the public health director, the emergency management team, and we're going to continue to try to do that. We have another availability at 2:30 this afternoon. We are trying to really focus on be mindful of helping people understand the risk that they're in, the risk they were in yesterday, the risk they may be in next week. There's the risks that none of us can change, such as how old we are or maybe our backgrounds, and how systemic racism can affect how you're experiencing risk. Whether you're working in a public-facing job, in healthcare, whether you're able to telework. So we try to help people understand risk. We also try to give them information on what they can control around their risk, such as, you know, all the good hygiene, hand washing, distance, staying local, and the face coverings. As we are heading toward whatever we're heading toward, wherever we're going, we really realize that we have collected so much information and developed so much guidance that it can actually be overwhelming. So yesterday we unveiled, and that's what you're looking at right now, a very highly usable, our good old COVID-19 website has been redesigned by Jennifer Snarsky and Tara Bowen-Biggs, big shout out to them, to be able to give people really, really easy buckets to look at and dive into, whether that's around guidance if they're a business or whether they are a reporter who wants to look at the latest dashboard. The other place that I think people overlook that is a critical way we communicate with the public is county employees who have face-to-face or virtually face-to-face and a lot of email conversations with members of the community. And right now, chief among them is environmental health. Jeff Martin and his team communicating a lot via email to give particularly restaurants, food carts, and other people who are really anxiously waiting the chance to reopen, sort of the latest information and what they need to be able to get ready. One of the most unsung communication vehicles, and I really just cannot say enough about this group of liaisons who have been working since March with in 27 different sectors, everything from housing, affordable housing, to business, fire department liaisons, licensed residential care liaisons, food access, parks, childcare, youth. They are a combination of both community members, volunteers, and county employees, a lot of them from the health department, who have just provided invaluable connection to community. They've gotten more than 8,100 people to participate in their program. I did hear a number yesterday that I'm wondering if that needs to be updated, because I heard it's up to 13,000. They have responded to 3,700 emails. And I think more importantly, they've had 1 to 2 meetings a week with these specific groups, which now number about 400 meetings. And they've put on 25 webinars. And that kind of question, time to give people space to come together, hear from others who are in their circumstances, respond, and be really appropriate around whether this is something that we really need to get materials out on. It's helped us communicate. We also know we haven't done enough of it, and so we're also relying on them to help us get better at that. And that's just something that we're really committed to. And a big part of the work that has emerged, I really want to note, is through a partnership with Prosper Portland. And thanks to John Wojciechowski from Office of Sustainability and Nicole Buchanan and people like Vanessa Tharp, who's one of those amazing liaison leaders in the EOC. Prosper has come forward with to work with public health to develop some really highly usable and shareable reopening collateral. So these would be signs that would go in businesses that businesses can get, no matter where you are in the county, no matter how big you are, no matter who you know, and they're doing it in simplified Chinese, Vietnamese, Russian, and Spanish. And it's just really practical advice for businesses, sort of giving them the friendly reminders to their employees, to their customers, and also to them to, I think, help people do the right thing. I think Dr. Vines has trained us all that, you know, public health's best guidance is that we try to give people direction and then make it as easy as possible for them to do. And I can't thank Prosper Portland enough for helping us do that. We're also sharing our partners campaigns, which Washington County, being a little bit ahead of us, they've got some CARES Act money. They're investing in a big media campaign, and you may be seeing some shared material that way. And finally, Marina, if you want to click to the next two slides, just our own campaigns that really remind people, and the next one, that we all are sort of have a part in this, and we're all going to be working together. So happy to take any questions, but realize I've said probably enough. Thanks.
Thank you, Julie. And Jenny Madcore, would you share with us the information that you found about non-essential and essential travel?
Sure, Chair. This is Jenny Madcore, County Attorney. The governor issued an executive order number 2025 back on May 14th, and that order speaks to gatherings and travel and many, many other things, of course. And I was just flipping through, so I need to get back to it. Here we are. At page 10, it says that individuals should continue to minimize non-essential travel wherever possible, and you should travel the minimum distance necessary for activities including travel, healthcare, emergency services, and other. So there's a lot more to it, but I would summarize it to say that under the governor's current order, we should minimize non-essential travel wherever feasible.
Thank you, Jenny.
Thank you, Jenny. That was very helpful. All right. Julie, don't go anywhere because we've got a question for you from Commissioner Dreyfus.
Thanks, Chair. Thank you, Julie. It looks amazing, that new page. Just one detail question. The Prosper piece, I think that is something that constituents are going to be really interested in. And you may have said this and I just missed it. Is that up and running? Like, is there a place that people...
Yeah, so they're just doing some final. There are some final design and refining that Prosper was doing, and it will be on the Prosper website, and it will be on our Multnomah County website, so that when you go to that guidance, which is right under, as you're on the COVID page, people will be able to find it pretty easily. And we'll also try to push it out so that people can find it, because I think it is something. And it's also given us an idea. We're certainly not looking for, there's no sort of one way to do everything. And so we're also looking for where the gaps might be around that, and giving us ideas about the signs that we could make and push out to people free downloadable signs that can help them sort of achieve their goals of social distancing and or physical distancing and hand washing, et cetera.
Yeah, that's great, especially for small local businesses. I think that's going to be really great. Thank you.
I have to say I've been impressed as I'm walking through the business districts in my neighborhood. The Multnomah County signs that were sent out early on, everyone has them in their windows. So it makes you feel good that the public is responding and the concerns are responding to the materials that we send out and utilizing. Great. Well, thank you all. I think that comes to the end of our presentation. I know that commissioners have questions and comments. mostly comments moving forward. So we're going to start with District 1. Mr. Murray.
Great. Thank you, Chair, and thank you so much to everyone for all of your tireless work on public health during this public health crisis. You know, I'm not sure when you sleep, when you eat, but somehow you're getting through this, and I just appreciate you all so much. Just speaking in general to the the idea of reopening, to summarize what I understand our position to be, that we have noticed that cases in the state have been increasing. There's been this uptick since reopening, and we, to some extent, we expect that. And we've seen protests, especially in Multnomah County, with very large numbers of people, limited physical distancing, high population density in those protests, and we're doing what we can to help people while they're engaged in those gatherings to be as safe as possible. And we also know people can be asymptomatic. They can spread the virus even if asymptomatic, and it can take 14 days before a person develops symptoms. So that's kind of challenging in the context of when the mass gathering sort of started and when we'll know whether there's a really dramatic or significant uptick in number of cases. So, all of that being said, our point is that we have to reopen at some point. And that decision has to be made based on assessing and balancing risks. We obviously have a lot to lose from opening up too much too soon, including a potential upsurge in COVID transmission and death, and potentially needing to even further shut down the economy. We also have a lot to lose from unnecessary delay in terms of people just being able to earn a living and get back to work. So we know there's never going to be a perfect time when we know there will not be further cases if we reopen. So what we need to be doing during this time as we're contemplating reopening and weighing those risks is to mitigate that risk. We need to decrease the risk so that it's as low as possible while we move through reopening and toward the new normal. And that does bring me back to face coverings. I will not belabor my overarching reasoning about why we should require face coverings here. I know my colleagues are well aware of my position, to say the least. And I really do appreciate Rachel and Jen's perspective and information that they brought forward. I do want to sort of speak to a specific element in terms of how this directive or mandate could be perceived or applied. And I know which Rachel and Jen are working on, our whole public health team are working on, and need to balance in the context of the epidemic of COVID, and that's the epidemic of racism. And many of the concepts that are talked about in public health have to do specifically with health disparities, disproportionate impact on marginalized, vulnerable, and underserved communities, and particularly on communities of color. Racism itself, as I said, is a public health crisis with tremendous disparities between people of color and their white counterparts. And police violence against Black people, particularly Black men, is an epidemic in our society, and I think should be taken on in the public health context as well. So in sort of the picture and the environment and experience and landscape of all of this going on with these dual pandemics, I absolutely hear the concerns that our public health team has heard from community members about masks. And I've read innumerable articles and social media posts around this, along with a lot of the literature on why masks would be so beneficial. So I believe, as I've mentioned, we need to acknowledge and address those concerns of community proactively. And I feel we need to approach the issue from a population health, evidence-based, and community standpoint. So in that regard, and I appreciate Dr. Vine saying that, right now, here is where we're at, and we might get to a different place, because I feel very strongly that we should get to a different place. So I do, plan to pursue board action on this. And Chair, I would very much like for this to be added to our agenda next week. And until then, I'll send all my fellow board members some information, which I'll also post publicly on my website, and we'll reach out to each of you to discuss individually. Face coverings decrease virus transmission and can save untold numbers of lives for everyone. There will never be a perfect time for reopening, and there will always be risks. But whenever we reopen, we need to mitigate those risks as much as possible. I personally feel it's irresponsible of us to say we're doing what we can to mitigate risk in this particular county at this particular time if we don't have a directive of some sort in place to ensure face coverings are required and making them available to those who need them. Thank you so much.
Thank you, Commissioner Myron. And next, we have Commissioner Granville.
Thank you, Chair. I actually do have a question, and I apologize, but I'm going to go way back in the presentation. It took me a while to think of it.
I'm sorry, time's up. Time's up. Yes, go ahead. Sorry.
I'm going to keep forward with my question. It is for Kim. And Kim, there was the slide where you showed us case counts and the graph of BIPOC and white case counts. I thought what I saw was an increase in BIPOC cases, and I see that Marina's trying to share that slide. But looking between May 10th and May 31st, there was a clear increase in the number of BIPOC cases. And I'm assuming that is because there's been an increase in testing. One of the criteria was also monitoring disease spread and prevalence in BIPOC communities. So could you talk about that and what, from a public health perspective and that equity lens focus perspective, you're thinking about that increase in BIPOC cases and how it affects our decision to open or not reopen?
Yeah, thank you. There has been an increase in cases. I'm not convinced that's all related to just increase in testing, meaning increase in identifying folks who would have already been there but just not be counted. We do know that we are working with some different clusters of cases, not like a worksite outbreak, although depending on the worksite, that can have a significant overlap with a certain community of color. But we also have some clusters of cases in larger households and social groups. And so we have a whole toolbox, if you will, full of strategies. Unfortunately, vaccine is not one of them, which would be fantastic if it was. But we have other approaches and strategies that we can use that are very culturally specific and community focused. And when I say community, I'm not talking about a whole community of like a racial group spread across the county. I'm talking about that very small, like really organic social and cultural community. There are ways that we're looking at reaching out to folks through their own social networks and word of mouth, and looking at who are, the key heads of households, if you will, or faith-based leaders who can carry the message both about prevention, but as well carry the message and even bring folks together so that we can bring testing to them. So we're looking at some of those strategies we'll be using over the next few weeks. And then we're also looking at what are some of the different ways that would be acceptable if folks do live in large households specifically and they do have an infection. How can they isolate themselves to keep the rest of the household safe, and what that would look like? So we've been in some dialogue with community members about, is a motel voucher the best thing to do? Are there other ways that people we can help people identify closing a whole sector of businesses, for example? We do think most of the training we have is going to be from people who know each other pretty well. because just by nature, those are the folks who are going to be in closest proximity to each other physically and spend the longest amounts of time together. So some of the strategies we have to work with social networks may actually end up being more impactful than strategies that we have for like a business sector, for example.
Mm-hmm. Yeah, I appreciate that answer. And actually, Marina, if it was a couple of slides back. I just want to make sure we have the one that I was thinking of on the screen. One more. Yep.
That one.
Yep.
Yep. You just went right past it. I think
that one.
Yeah.
It's that one because it's really pretty striking. But we also see spikes like that 94 spike, so that suggests that it could be very episodic. What was the criteria that we laid out for ourselves on disease spread and prevalence in BIPOC communities? Was there a specific measurement, or was it more of a we just want to make sure we can track it criteria?
We hadn't identified a specific number as a threshold or a specific percentage increase. We knew that it was really important to us to track it. The week-to-week variability and the numbers being as small as they are here, we would need to run some careful statistical analyses to say how much of that variability can just be like random changes, how much of that could be a particular work site or a particular group setting, right? We have so few cases overall, frankly, compared to many, many other places that if we have even a small outbreak of 20 people, that's enough that week could look a little bit different depending on who's in that outbreak. So it's hard to make like a high-level policy decision over just 1 or 2 weeks, but I would ask you all to think about the graphs you probably remember from February and March that were logarithmic, that looked like this. And this is going more like this. Mm-hmm. We started to see a doubling, and then in 3 more days, another doubling, and then in 3 more days, another doubling. That's the kind of increases that we were originally seeing. So this graph doesn't look anything close to that. It doesn't mean it needs to be ignored. You know, we need to focus on it really carefully. And the deeper dive is the conversations that I have, like with our case investigators, to say, who are those people that are being represented in this graph? What languages do they speak? What kind of jobs do they have, right? How are they interacting with each other right now? And then who do we know who connects well with them and is trusted, and how can we partner with them? So there is a story here that's being told, and there are certainly responses that we can take. But I do just want to like bring everyone's minds back to that kind of like logarithmic increase that we all had. It looks decidedly different from this right now.
Yeah, totally appreciate that. I mean, it is a doubling, but it's only doubling over 2 weeks. I guess the other thing that strikes me is that it's also an increase at the time when we're seeing the number of cases go down for the white population. So like a different trend. But I get everything you're saying about low numbers in short period of time.
And yeah, I don't want to diminish that disparity between those two. I mean, that's stark and obvious, especially for folks who know what the demographic makeup is of our county, for sure. And that's not even a percentage, that's actual case count difference. So all the focus that we have on that racial justice lens is absolutely crucial for us to continue. Yeah.
Thank you. So, just a comment, not a question, and not necessarily for you, but it is related to what we were talking about in terms of the approach we're taking, which is absolutely the right approach of this very granular, specific, community need-based response to the spread of the disease. And where it takes me is the question of funding, which I know was not on the agenda for today, and it's, or maybe it is, maybe it's coming later, but all that approach takes funding. And I'm not sure, Chair, where we are in the conversation about funding, or whether we're going to get another briefing on it before we have to vote. But, I think we've all said, and I certainly said from the beginning, that if we don't have the funds to do the plan, then we can't responsibly reopen. And we certainly can't responsibly reopen and say that we're focused on equity, because most of the cost of our plan, the really detailed cost of the plan, is about equity, and it's about mitigating and preventing spread for our BIPOC communities. So, sometimes it feels like we're on this train, and I'm really concerned about continuing to barrel forward if we don't have the resource to pay for what we need to do.
Very good points, all of those. Commissioner, I would say that we are still in contact with our partners at the City of Portland and at the state. There's been a lot of movement, but we don't have the actual dollars yet in May. I don't suppose that we will have a firm commitment that, I'm not predicting that we will have a firm commitment until before we vote on our budget, which will be I'm sorry, I'm being told I was not clear. We will have a firm commitment before we vote on our budget. That is what Commissioner Vega-Pugh?
Thank you, Chair. I just want to thank everybody for the presentation today. I think for me, I don't have any new questions at this point, but I really am, I share the concerns of my colleagues that, then we just, and I mean, all of us, that, we just are going to still need to track the numbers as we move into reopening and make sure that as we're, as we're reopening, we're really understanding what the data is telling us and how to respond to that in the best way. And I think the plan that we've put in place is one that would allow us to respond in the right way, in that we are making sure that we're addressing the needs of all of Multnomah County residents as they're impacted by COVID, knowing that Black and brown people are being impacted the most by COVID right now, and our response is responding to that in a really serious way. I'm interested to find out a little bit more about the hospitalization and the ICU use. The question that I had asked earlier, because I think that's the area that I have the least visibility in, in terms of who I'm having conversations with and what I'm hearing from community. I don't really have insight into the hospital systems right now. But to Commissioner Jayapal's point about like the graph that she was concerned about and what she thought, I remember hearing early on in this that if you took out the nursing home population, the people in nursing homes that were impacted by COVID outbreaks there, that other than that, like the number of communities of color that were impacted by COVID were higher by far than any, than the white population if you just took out the nursing home. So I think that that's something that we have to continue to pay attention to on both fronts. Like this has always been something that's been impacting our Black and brown communities at a higher level from day one. And we also have to, make sure that the work that we're doing around settings like nursing homes and workplaces where we've seen these outbreaks, all of the congregate care settings, that we have the plan and we have the responses in place, and that takes the work of our public health folks, of course, but also working with the state to push for the proper response and the proper guidelines in place for that. So thank you.
Thank you, Commissioner. And now we have Dr. Sidney.
Thank you, Chair. I did have one question. So Rachel, it sounds like did we get an update from the state of Oregon about the status of our application? So we know that we're on the right track to be approved to be opening on Friday?
So we have not received that information from the state thus far. My understanding is that they, because they knew that our plan was to look at data and to see how we were doing, that they were going to see how that went and then would provide us more information.
Okay, great. But clearly, the data you've presented indicates that we are meeting all the metrics and we don't foresee any issue with not meeting those metrics.
I think we're meeting most of the metrics. We have seen that uptick in the hospitalizations. The state has said pretty consistently, and also we've seen this in their approval of other counties' applications, that they are looking at it as a case-by-case, and one specific metric may not outweigh their ability to approve applications. So they have consistently shown flexibility in that way, where they will approve applications of folks who may not be meeting one metric or the next. They're really looking at the totality of the situation.
So is it your hope that we would hear from them tomorrow? When would we hear from them?
Yeah, I mean, that's a good question. I think it would be great to hear from them tomorrow.
Okay.
And have a sense of where they're going.
Okay, great.
Yeah. Commissioner Stegman, I will be in contact with them tomorrow if we don't hear something from them. I know that, I mean, one of the reasons we waited a week is to look at the numbers, but it was also to give people time to plan. And so we would like to know sooner rather than later for this year.
Great, thank you, Chair. So I'd like to respond to Commissioner Myron's request around face coverings. And I am deeply concerned about mandating the use of face coverings. We all know right now that Black Americans are at a huge risk of racial profiling. We also know that COVID and racism disproportionately are killing Black Americans. I did read an article in Mother Jones that talked about something called the signaling process. And their definition of that is that some individuals have to ask, what are ways that they can signal to people that they are not a criminal? That is just so far from anything that I could ever have to imagine that anyone would even have to think about. Yet I fear that many people do. We know that BIPOC folks, they have to make conscious decisions every day about how they show up in the world and how they're perceived by other people, and most importantly right now, how they're perceived by the police. We know that BIPOC people are less likely to be able to work from home, so therefore they have to go out in the community. They don't have a choice. So I fear that for some folks, this is a lose-lose situation if we were to mandate face coverings. I am not comfortable implementing a policy that will encourage police to stop Black men for either wearing or not wearing a face cover. And we talk a lot about equity, safety, trust, and belonging at the county, and I'm really proud of the work that we're doing. But we have a lot more work to do. And I think it's incredibly important that we continue to walk the talk. I cannot support mandating something that I think is inappropriate. I do, personally for me, I encourage everyone, I will wear a face covering when I go out, and that is my personal choice. And I do believe in the science. But I think it's a personal choice for other members of our community. So I am not in support of mandating face coverings. Thank you, Chair.
Thank you, Commissioner Stegman. My goal since the beginning of this pandemic has been to slow the spread of the virus, give us time to build a strong response plan, and a strong community relationship. It is my belief that we have got now to learn. We've moved from the emergency phase to learning to live with this virus, and it is going to be a continual dance. We're going to be constantly watching the numbers, we're going to be listening to our community, and we're going to be ensuring that we are implementing the plans that we've created. The plans around community testing, around contact tracing, and around isolation and wraparound supports. We will take action and adjust our response if needed as we continue throughout this process until we end up with a vaccine or a cure. So I think you've heard today from commissioners that we are planning to move forward into phase 1 on Friday if the state gives us their approval. I'd also like to talk a little bit about how we move forward as a group. We are going to continue to have these briefings on Wednesdays where we will be assessing the data. We will be actually adding more details to the data. Today you saw some of the information on race and ethnicity around people who have been tested. We will continue to decrease the number of unknowns. We're also going to be looking more carefully at how the disease is spread, under what conditions, and in what settings. And then we will soon be also releasing our internal recommendations as we look to open up Multnomah County as we're looking opening up our own buildings and our own. So there is still a lot to do. I know that we have a very able team. As commissioners, we've spent a lot of time with our public health team over the past few months, and we know their commitment, we know their dedication, we know their intelligence, and we know their heart. And I feel very confident that we have the team to help us through. We still have work to do, but I want our community to know that we are in this together, and we want to have the best. We want the best for our community. So I think that is it for this afternoon. We will see you all. Today's Wednesday, right? We'll see you all tomorrow morning at 9:30 for our next board meeting. Hello.